Okay, so for this afternoon, we'll have community organizing, problem prioritization, program planning as part of your requirements in your clerkship. Okay, so preventive medicine and community health, of course, will not be complete if we do not have any discussions on community diagnosis, how to move in the community, etc., etc. We would have liked to bring you to the community. Our community is a health center in Green Valley, Cavite. However, even if clinical rotations would resume face-to-face. Community rotations would be the last to be brought back. Although we are working on it such that we could bring you to the community. So for now, we would have to suffice ourselves with discussing theories on community organizing, the changes that have taken place, especially with this pandemic. Okay? So, what is community organizing? What is your understanding of community organizing um, as a discipline? Why do we need to learn this as medical students or would be doctors in the field or in the hospital? Anyone? Good.
Doc,
Shari.
community organizing po is an approach po wherein we help people po in the community to identify their problems po and then help them find solution po to their problems.
Definition of community organizing would be helping people to find solutions to their problems so that they could solve their own problems. Kayo ba ang community organizing, Shari?
Yes po, Doc.
Sige. I wouldn't preempt your report. Okay, you may start to screen share. So it's just a segue while we were waiting for your co-clerks. Okay, and interns.
Okay po, Doc.
Okay. And the discipline, especially with the pandemic, is changing. Nakaka-share ka na ba, Shari? Allowed ko na ba? Oh yeah, okay. Go ahead. And it's continuously changing, especially now. Of course, community organizing would entail a lot of going to the community, but however, with the social distancing happening, of course, that is not always the case. So, without preempting the report of the local clerks, we will discuss after. Let us hear from them first. Okay?
Doc, one of the local clerks po are nasa waiting room po, Doc.
Ay, sige, sige. Ito na.
So good afternoon po, doctors. Now we will be discussing po community organizing. So the topics to be discussed. So first, we have the definition of community organizing, skills for community organizing, aims and goals, the principles, approaches, and models, organizing for and through health, qualities of a good organizer, community organizing activities, as well as the stages of community organizing. So first, we have the definition of community organizing. Community organizing is one of the strategies adopted in any community development project that requires full participation of the community. According to Ross in 1955, community organizing is a process by which a community identifies its needs or objectives, order these needs or objectives, develops confidence and will to work at these needs or objectives, finds the resources to deal with these needs or objectives, takes action in respect to them, and in doing so extends and develops cooperative and collaborative attitudes and practices in the community. So in other words po, community organizing is a long-term approach wherein, again, the people po affected by the issue are supported in identifying their problems as a community and taking action po to achieve solutions through collaborative attitudes and practices in the community. So next, please. Community organizing is a continuous and sustained process of educating the people to understand and develop critical awareness of their existing conditions, working with the people collectively and efficiently on their immediate and long-term problems, and mobilizing the people to develop their capability and readiness to respond and take action on their immediate needs towards solving long-term problems. Also, in community organization, it is composed of community empowerment, which means that it is a process that helps people gain control over their own lives. It also includes community development, community advocacy, community organizing, community mobilization, community participation, social empowerment, and social mobilization. Next po, we have the skills for community organizing. So first, organizers must be capable of listening, and this requires sensitivity to the challenges, beliefs, and values held by individuals. Next, an organizer can be culturally sensitive and inclusive at the same time through building relationships. So the organizers have to be capable of building relationships that entail honesty, trust, sharing, empathy, challenge, and acceptance. Next, we have challenging. An organizer typically challenges an analysis, assumption, perception, or belief. So the purpose of challenging is to advance the understanding of the causes of the issues and to deepen the reflection individuals have of their own values in relation to these issues. And lastly po, we have clarifying self-interest. So organizers discern self-interest by listening to the stories, experiences, and priorities that individuals share in conversation. Listening for self-interest allows the organizer to understand what people in the community are capable of doing together. Next, please. So next naman po would be the aims and goals of community organizing. Next, please. So according po to Apuan in 1988, there are 3 goals of community organizing. First is to achieve effective power for the people, to establish and sustain relatively permanent organizational structures which best serve the people's needs, and to build or join alliances that are useful to the people. Next, please. On the other hand naman po, Rubin and Rubin in 1986 po proposed 4 goals naman po of community organizing. So first, we have enhancement of people's potential and the increased likelihood that they will fulfill their potential, improvement in the quality of life through the resolution of shared problems, exercise and preservation of democratic values, and improvement in the overall equity in society.
Now we go to the principles of community organization. Sorry. So, principles are expressions of value judgments, and the principles of community organization, which are being discussed, are within the frame of reference and in harmony with the spirit and purpose of social work in a democratic society. So, according to Dunham, in 1958, he has presented a statement of 28 suggested principles of community organization, and he has grouped them under 7 headings, namely democracy and social welfare, community roots for community programs, citizen understanding, support, and participation, as well as professional service, also cooperation, social welfare programs, adequacy and distribution, as well as organization of social welfare services and prevention. So, under the principles of community organization, Apuan came up with the following principles that should guide community organizers. So, community organizing involves consciousness raising through experiential learning. So, central to the community organizing process is the development of awareness and motivation among the people to act upon their problems. So, the community organizing therefore emphasizes learning that emerges from concrete actions. Community organizing is participatory and mass-based, so this involves the whole community in organizing experiences and is primarily based towards and biased in favor of the poor. Also, community organizing is based on democratic leadership, so it is group-centered and not leader-oriented. So the leaders emerge and are tested through concrete action and not externally appointed or selected. Hence, the leaders should be accountable to the people at all times. The other tenets espoused by the International Institute for Rural Reconstruction are what the PBSP in 1991 used as its guidelines in its community organizing activities. And they came up with the following. So, they must go to the people and live among the people, learn, plan, and work with the people, start with and build on what the people know, teach by showing, learn by doing, not piecemeal but an integrated approach, and not relief but release. So these principles, which the IIRR espouses, embody the ethical principles of community organizing. So according to Swanpole and De Beer in 2006, they came up with another different kinds of principles. So the first principle dwells on human orientation, which says that community organizing must be able to address the people's concrete needs such as food, clean water, clothing, and shelter, as well as fulfill their abstract needs, happiness, self-reliance, fulfillment, and human dignity. Next, the second principle, which is about participation, says that people must be mobilized to participate in full aspects of community organizing activities. And the third emphasizes that concept of empowerment, which must aim to give people the power or right to make decisions. The fourth principle highlights that community organizing must activate people to take up the responsibilities of ownership and manage their future. Lastly, community organizing is aimed at breaking the deprivation trap so that people can become free. Transforming efforts attempt to release people from the trap so that free and self-reliant, they can gradually improve the situation themselves. Um, Keeping in mind actual practice situations in India, Siddiqui in 1997 has worked out a set of 8 principles. So these are the following po. The principle of specific objectives, the principle of planning, the principle of people's participation, the principle of intergroup approach, the principle of democratic functioning, the principle of flexible organization, the principle of optimum utilization of indigenous resources, and lastly, the principle of cultural orientation. Now we go to the approaches and models of community organizing. So for the approaches to community organizing, in 1955, Ross came out with three approaches to community organization depending on the objective of the group. Namely, first, we have the specific content objective. So for this approach, an individual, an agency, or an organization becomes concerned about a needed reform in the community and launches a program to secure this reform. For the general content objective, um, a group, association, or a council focuses on the coordinated and orderly development of services in a particular area of interest. While for process objective approach, the group aims to initiate and nourish a process in which all the people of a community are involved through their representatives in identifying and taking action about their own problems. Two other major approaches to community organizing were later on formed, namely the project approach, which attempts to organize communities around certain projects that aim for community self-reliance, as well as the political action approach, which focuses on collective action in which the community makes known its grievances and its demands to relevant authorities and to the public. So for the models of community organizing, Rothman in 1968 developed the three models of community organizing. First is the locality development model. For the locality development model, this holds that the community changes can be pursued most effectively by widely involving the local people in determining and achieving the goals. So this is used when populations are homogeneous or when consensus exists among various community subparts and interests. Another model that he came up with was the social planning. So this one necessitates that services of experts in affecting planned change processes, especially in solving social problems. So this is adopted when community problems are fairly routinized and can be solved through application of factual information. And lastly, he came up with the social action model, which is premised on belief that there are disadvantaged segments in society that need to be organized to enable them to voice out their demands for social justice or democracy. When community subgroups are hostile and interests are not reconcilable, through usual discussion methods, social action is the most suitable model for community organizing. Next, we go to organizing for and through health. So in organizing for health, the health issues and needs are marked as priority, mainly from the eyes of health agencies and professionals. While from the perception of communities, they look at health services, passive beneficiaries, participation mainly at the intermediate level, and it is essential but not a priority need unless physically incapacitated due to the illness and it is limited to health. While organizing through health it is more comprehensive and there's economic, political, cultural, and social problems that are being raised. It recognizes that health is essential, but there are more immediate and pressing needs of the community and community members. So principally, it focuses on economic issues, and communities are not only as recipients of health services, but communities in need of more encompassing community action.
Earlier, we've discussed about the skills that an organizer should possess. Now we will talk about the qualities of a good organizer. So, good organizer, next slide, please. So, a good organizer should have good imagination and a good sense of humor with blurred vision of a better world and has an organized personality. Also, he or she should have a strong sense of oneself, and free, open minded, and politically relative, and has the ability to create the new out of the old. Now, community organizing activities. So first, we will discuss about the area or site selection. So basically, we select our area or site, based on the population of at least 100 to 200 families per two new COs, with knowing that it is an economically depressed community, with no strong resistance from the community, and has acceptable peace and order situation. Next, we do the en- entry into the community. So it is also otherwise called integration. It is defined as establishing the rapport with the people in the continuing effort to imbibe the community life by living with them and undergoing the same experiences, sharing their hopes, aspirations, and hardship towards building mutual trust and cooperation. Next would be the community study. This is where we categorize the community and we study them for their priorities and specific needs. Next would be the spotting of potential leaders. So we need to assign or spot for leaders who are productive, well respected by the community, capable of working for change, conscientious and resourceful, and can communicate. Then after we assign for potential leaders, we now form for the core group, which will bring together indigenous leaders capable of exchanging knowledge and insight toward a deeper understanding of the dynamics of the community. Then after we form the core group, no, we would form also the community organization, who will facilitate the participatory and collective action of the community problem. So this aims to maximize the participation of the members and maximize the control of the people. So this is what we call collective leadership. So then we mobilize, which refers to the activities undertaken by the community organization to solve problems confronting the community in order to build and strengthen the people's self-confidence and collective spirit. Then we evaluate, which the process of discovery by the people of what has been accomplished, what has been left out, and what remains to be done. So the goal here is to maximize participation of the people, and to have dialogues, forum, workshop, and last but not the least would be the follow-up and expansion, in which we provide support services to the community by linking with other agencies and sectoral groups, and plan for long or short-term programs and regular monitoring of their activities. Now we have the stages of effective community organizing. So there are 6 stages of effective community organizing. First would be we assess the community, its priority and specific needs. Then we create an action team. As I mentioned before, we spot for potential leaders, we form the core group, and then we form the community organization. Then we develop an action plan, which involves the community and its the 100 to 200 families, yung population ng community. And then next, we mobilize to action. And then we implement it with the help, no, of the community body, and then we evaluate. That is for all. Thank you.
So, look, going back to that slide of your principles of community organizing, what are the current practices in the medical field that could have a little help in your could be helped by your principles?
Sorry, Doc. What was the question po?
So you mentioned some principles of community organizing. What is evident in in medical practice um, that we need to change, for example, so that community development or public health would be um, gain more traction. What was that? Relief, not go back to your
Not
slide.
release po, Doc.
Relief, not release. Okay. Go to the people, build on what they have. Okay. So healthcare, when we are talking about um, organizing, what's the most common means of organizing that healthcare would be involved in? Not relief, but release. So remember your medical missions. Does it give relief? Does it, yes, but does it give release? Or does it just foster dependency? Further dependency on the healthcare worker. Nilipat mo lang, sorry, there are international. You just changed the location from a hospital-based setting, you went to the community, but the same, right? The patient goes there, you give treatment, and then it's done. Okay? So, how would you improve that paradigm of medical missions? What is done by organizations so that it is not just relief but release?
Doc, the one that
In my
in
opinion
medical,
po, Doc,
oh, sige.
the sorry, ikaw na muna.
Okay, one by one, we have time for all of you.
Sige po, Doc. Doc, ako po, in my opinion, what we do in medical missions is aside from yung usual na taking it out of the hospital and into the community, we also do yung mga seminars after to at least teach them so they won't be too dependent on doctors, and it will also lessen what they know, especially now po na rampant yung mga fake news, so it's also helpful then to teach them how to properly educate them then on certain common illnesses that can be prevented within their community po.
Mm-hmm. So you give health education. So what you will do instead of outright medical mission, before you do consultations, you give seminars before they are allowed to have your free consultation. So it's just like how some schemes in marketing would go. Uh, Before you could get the free, you have to listen first. Okay? O sa you have to listen first, then you'll get free consult. At first, they will look at it that way. But those would be already captive audience, yes. And you will not be able to reach all of them, I'm sure. So out of 20, you are able to reach 3 or 4, you should be happy. That you are able to impart knowledge one by. Of course, doing the medical mission one by one, your patient, of course, you do not go, what's your problem, or this is the medicine, or you have to do individual patient education as well. Most done in medicine, teach by showing, learn by doing. Right? In clerkship internship, how to do NGT, how to do IV insertion. So you are expected, once that you are taught how to do it, you see one, you learn to do one, and what's the next step after that? If you know, you could teach some other person what to do in, for example, in the clinics. Okay. So, with this current situation that we are having, how do you think community organizing would have changed in our situation now? How did the field adapt? to the problems of a pandemic wherein there would be limited contact. So how will you go and live among the people? Learn, plan, and work with the people, etc., etc. May idadagdag pa ba? Sorry, nakalimutan kong someone else would want to share previously. Si Shari ba yun?
Yes po, Doc.
Would you like to add something?
Yes, aside po dun sa sinabing seminars and educating the community, I'd also like to suggest po yung follow-ups, especially po pag if for example, we ask the patients to take some medications or we treated them, so we need to also do some follow-ups by maybe through the barangay health clinic po, so that we would know if the patient followed the uh, physician's instructions and prescription po.
Okay, agree. And it's not piecemeal, but an integrated approach. So there's an individual, but in community organizing, you look at the whole community and how it responds to problems. Okay. How, going back to my previous question, how did it change? How did it adapt to a new situation? Of course, in community organizing, you have mentioned qualities of a good community organizer, that is that they are flexible, adaptable, and are able to work in all environments. So, how did the field adjust? So, how would you organize in this day and age, 2021, coronavirus pandemic, etc.? For to make my question more direct.
Doc, during this time of pandemic po, what I've seen is that people are more um, aware and involved po, especially po the um, in the government sector, like yung mga barangay, the 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 government, like the people who makes the laws, no, are involved with the health needs of the people, and they communicate more than much better than before, because they coordinate from the lowest unit up to the bigger sector. Also, we do telemedicine, in which the patients have individual communication with the private physicians.
Okay. So communications, your social media would be a lot of help. Okay. So for example, the issue of vaccination, you have mentioned that there are a lot of fake news. Okay. For the issue of vaccination, what could you do as far as the what could community organizing do to help as far as the issue of vaccination would go? How do you think a community organizer could help in this situation?
Doc, I think po, just as we have mentioned po earlier, we can do po mga seminars regarding COVID vaccines po, so that ano po, people, so that po the people po will be encouraged to be vaccinated po, Doc. I think po seminars po, as well as TV commercials, infomercials po are very helpful po nowadays po. Especially people po are using social medias na rin po.
You have mentioned the word awareness time and again. What? How do you define awareness? And why is awareness or arousing the consciousness of the people very important in community organizing?
Doc, awareness po, awareness awareness po, Doc, is the perception po of an individual po regarding po different information or situation po on a matter po, Doc.
Okay, and why is it important in the discipline of community organizing?
I think po, Doc, it is important because in community organizing po, di ba, we identify problems po in the community. So if people po are aware of what the community needs and what the community is lacking, parang ganun po, Doc. I think po, being aware po on the situation po will lead to proper action planning po, Doc.
Okay, so if the
If I may add po,
okay, sure.
community awareness din po would increase the community's knowledge of the available programs and services offered by our government. And this will also accomplished by informing the general public of the activities that are already um, provided po sa community, programs and activities po. So this will create po interaction between the community people and its environment, the government officials as well as the community health services. So the people would feel that yung involvement nila as well as po yung kanilang authorities na available.
Okay. So before you are able to organize people and ask them to mobilize, okay, of course you have to create awareness. So there it has to be a felt need. Okay. So for example, the problem of the coronavirus, why is it continuing to increase? There is a lockdown, but is for majority of the people, is there a felt need to isolate themselves? What takes priority? What takes precedence over isolating oneself at home for most of the people?
The need to put food on the table.
Okay, it's an economic issue versus a health issue. So why will I stay at home? So arguments would say I would not die of coronavirus, but I would die of hunger because I have no money, I have no work. So the felt need of staying at home to curtail the virus is defeated. So the purpose of the lockdown is very much defeated if people will continue to go out. Okay. Again, why isn't not a felt need? The people who work, what? They are usually the ones who are up and about. If they get the virus, they wouldn't feel anything. Then after 2 weeks, they are okay. They work. Oh, nothing happened until you transfer it to someone that is close to you, for example, a family member that is immunocompromised or a senior family member, then it hits close to home. Only then will you feel that felt need to isolate, o coronavirus is like this. Because most do not actually believe in the virus, say, oh, it's just a worst kind of flu, etc., etc. So awareness is very much important. Okay? Before you are able to organize and before you are able to mobilize these people to move for themselves and for other people. So for example, it takes a lot of health workers are um, posting vaccination pictures on social media. So that's a form of raising awareness, trying to reach your influence on social media. Is it just grandstanding? Oh, am able to receive the vaccine already. But it is a health worker showing a vast number of people what? That they believe in the virus works, etc., etc. Okay? So let's have the next reporter. Let's have who's ready? Problem prioritization.
Yes, doctor. Ready? Shall we go?
Okay. Share your screen.
I'm sorry, doctor. Please. Excuse me. I don't yet have the time. Is my screen visible, doctor?
Okay. It's better.
Is, is my screen visible, doc?
Yes, it's good to go ahead.
Okay. Good evening. Good afternoon, everybody. Today we are going to see about problem prioritization. So, what is a problem? A problem is a matter or situation that is considered unwelcome or harmful that needs to be dealt. It is a complex task that involves doubt and uncertainty. Now, moving on to prioritization.
The chat with you.
No, doctor, it is not with me. Somebody else's mic is.
Could you turn off the mic of the one with the child, please? I think you go ahead.
Okay, now let's see about the process of what is prioritization. The process of the process of listing out or deciding the relative importance of a group of things is called prioritization. So this the organizing things so that the important thing is done or dealt with first. So let us see about the process of prioritization. The prioritization involves identifying community problems, assessing the impact on each problem of the community, and it also involves the prioritization to identify the problem that requires immediate action. Okay. Why is prioritization done? The prioritization is done to meet with the following factors. Because the resources are limited, it is to be given fairly among the people who require it. So, prioritization is done. Limited resources and unlimited demands to provide justice and efficiency, and for the lack of consensus. Okay. So what are the approaches to problem prioritization? It goes from simple to complex. The method involves developing a consensus rank using votes, that is allocating points, and adapt criteria than using rank using votes. Here, adapting criteria involves choosing the specific or the right action that is required than the priority that is chosen by voting using that is brought up by ranking using votes. Okay. So, what is the criteria for prioritization? The criteria for prioritization includes the magnitude of the impact of the problem that affects the community, the evidence-based strategies that target this problem, uh, to see if the problem impacts other community issues, and what are they influencing, what does this problem influence the community, how does it influence the time and resource required, the energy, both social and capital energies, the timing, that is if it is a long term or if it's a short term action, the political realities and urgency of solving this problem. Okay, the methods or the practices that are currently utilized in prioritization include the multi-voting techniques, the strategy grids, the nominal group technique, the Anlon method, and the prioritization matrix. So let's see in detail about the multi-voting technique. Multi-voting is typically used when a long list of health problems or issues must be narrowed down to a top few. Outcomes of multi-voting are appealing as this process allows a health problem which may not be a top priority of any individual but is favored by all to rise to the top. In contrast, a straight voting technique would mask the popularity of this type of health problem, making it more difficult to reach a consensus. Moving on to strategy grids. Strategy grids facilitate agencies in refocusing efforts by shifting the emphasis towards addressing problems that will yield the greatest results. This tool is particularly useful when agencies are limited in capacity and want to focus on areas that provide the biggest bang for the buck. Rather than viewing this challenge through a lens of diminished quality in services, strategic grids can provide a mechanism to take a thoughtful approach to achieving maximum results with limited resources. This tool may assist in transitioning from brainstorming with a large number of options to a more focused plan of action. Okay. Moving on to nominal group technique. The nominal group technique has been widely used in public health as a mechanism for prioritizing health problems through group input and information exchange. This method is useful in the early phases of prioritization when there exists a need to generate a lot of ideas in a short amount of time and when input from multiple individuals must be taken into consideration. Often, the multi-voting technique is used in conjunction with NGT, whereby NGT can be used to brainstorm ideas and create a broad list of possibilities, and multi-voting can be used to narrow down the list to pinpoint the top priorities. One of the greatest advantages of using this technique is that it is a democratic process allowing for equal say among all participants, regardless of the position in the agency or in the community. The Hanlon method. The Hanlon method was developed by J.J. Hanlon was for prioritizing health problems in a well-respected technique that which objectively takes into consideration explicitly defined criteria and feasibility factors. Through a complex method, the Hanlon method is advantageous when the desired outcome is an objective list of health priorities based on baseline data and numerical values. Okay, moving on to the prioritization matrix. A prioritization matrix is one of the more commonly used tools for prioritization and is ideal when health problems are considered against a large number of criteria or when an agency is restricted to focusing on only one priority health issue. Although decision matrices are more complex than the alternative methods, they provide a visual method for prioritization, and an account for criteria with various degrees of importance. So moving on to conclusion of the problem prioritization. In a world with a growing number of health concerns, scarce resources, budget cuts, and conflicting opinions, it is very easy to lose sight of the ultimate goal, which is to improve the health outcome. Oftentimes, these external forces drive the decision-making process within the health department and make determining where to focus resources and time challenging. Prioritization techniques provide a structured approach to analyze health problems and solutions relative to all criteria and considerations and focus on those that will prove to have the greatest impact on overall health of the community. That's it, Poda.
Sorry, I was
Excuse
on
me.
mute. As you've mentioned, please just reiterate, why is it important to prioritize problems?
It is important to prioritize problems in order to face them, in order to list out so that the problem which requires immediate action is taken care of at the first.
So in relation to community organizing, identify problem. Of course, if you identify problems with the community, there will be a lot of problems. And we have
Yes,
to, yes, and we have to,
we
uh,
have to list out in order of the relative importance. So how they are interrelated with each other and which problem requires the most utmost importance and attention is carried out and taken care of at the first as
so
a
there's,
first step.
so there's a difference between, for example, the coronavirus last year around
Yes,
March, wherein the coronavirus was just first taking place. And for
yes, doc.
example, this year, the second lockdown where the coronavirus has been existent for a year. Okay. So what's the
Yes, doc.
priority? What's if you are to prioritize, if you were the government, what would you put
Yes,
priority
doc.
on?
Uh, my priority would be testing the masses of people so to identify the actual number of cases in a given community, because as the number of testings goes down, the total number of corona cases also goes down. My priority would be increasing the testing capacity of the specific community to provide and thereby to provide medical intervention and proper facilities for the people to get over corona.
Okay. So you have to prioritize. Initially, that was for last year, contact tracing, the people who are affected, etc., etc. Especially the vaccine is not available at that time. We have limited idea of what the virus is. You asked for lockdown. So there
Yes,
was, for example, in the Philippines, there was a 275 billion emergency fund. Where the government, or this goes for the local clerks and interns as well. What will you do with the money of the government given the situation?
Hello, doc. Hello.
Yes, Roy.
Yes. We can use that money to help the poor of the society, like they are what daily workers. Most that is most important thing, I guess.
Yes, doctor.
They are
Like we can afford the poor people who doesn't have food or like that for the limited
they,
resources for the daily basis.
who are daily wages.
Yeah, for the daily
We
basis.
should
Okay, so
Uh,
you agree that we will distribute it to the socially marginalized?
no,
yes,
according to me, the more money should be provided for the testing.
The
Like
money
if
should be
you
provided for
for test,
testing.
Yeah, and later, on what stage we are in right now, we should use that money for vaccination more. Because if we will just feed the poor, we won't stop the virus. We have to cancel the virus first.
So control
Vaccination.
the virus first. So
Yeah.
health takes precedence over economy. Okay. So you know that the Philippines has been in lockdown for almost a year. I'm sorry.
Yes, ma'am. Uh, Ma'am, according to me, instead of forcing the mass lockdown, we should prioritize on making small containment zones. That way, the economy will not suffer that bad.
Okay. So instead of forcing, eventually you would ask for mass vaccination, etc., etc. So now, after a year long now after a year long lockdown, they say they want to open the economy even if the cases are rising because they say that the economy cannot bear to be closed any longer. So what is your take on that?
And look, anyhow, we should support the economy because the thing is that during lockdown, most of the people who are not even affected from the virus, but most of them are affected by hunger, by poverty, and many other problems. So it is also one of the big cause uh, to be faced by the government right now. So we should also focus in again helping them to withstand their work to have to raise their business also. The people we should government should help. Like for example, there should be less tax in the year 2020 so that people can work accordingly. Tax should be less. People should be given loans on less interest and all.
Okay, any other opinion?
Yes, doctor. The economy is a main factor for a country to develop. After for a year long lockdown, the economies of most of the countries have gone down. It is by proper preventive measures such as maintaining social distance, wearing masks while going outside, and washing their hands frequently with hand sanitizers or soaps. So those preventive measures must be carefully followed by the people to actually prevent the disease from coming to them. And thereby, if they follow this properly, they may have a chance of not getting it, and thereby they can work properly and boost the economy as well.
Mm.
Doctor, to add on what he said, I would like to say that we don't know when the virus is gonna be eradicated, so we cannot afford a very long lockdown because it would ultimately lead to economy crash. So like he said, we can also encourage vaccination and frequent testing in order to identify cases and contact trace so that we can contain the virus but also preserve the economy of the country.
So it's a
Uh,
it's like being a parent. You have a lot of children and you have to prioritize the needs of each one. So each would have different needs and would have different um, number of needs. So remember Dr. San Luis's equality versus equity. You could also put that into consideration when doing problem presentation. Okay. Yes, I understand the middle class would pay the taxes, but who would be in the most need to get that social amelioration fund or the money from the government?
The poorest of poor.
It's the poorest of the poor, those who are really marginalized. Okay, but how they use it in the first, how they use the fund, that's another matter because it's disheartening to see people getting funds from the government and you see them spending it on nonsense things and not for
Yes.
food, etc., etc. Because primarily they weren't taught or they were not taught on how to manage finances properly. But then again, that's because it's a cycle. It's marginalized. How to prioritize their money. So most of the marginalized are used to, I have money to spend, I spend it today. Because they are used to that kind of scenario. I earn money, I spend it. So the concept of saving, etc., etc., the lockdown may be longer than 1 month. The government may not have another round to give people. And again, that's the root of the problem. Okay? So, for sa locals, what do you think? 275 billion Bayanihan Fund, was it used appropriately, or it the government could have done better? Anyone? Sa interns, sino ba ang interns nandito?
Good afternoon po, Doc.
Winona. Oh, sige, Winona.
I think po we could have done better in a sense that hindi po kasi na-prioritize yung contact tracing from the beginning. So from there parang nagkaroon na po ng issues on sino yung mga kailangan i-quarantine or like i-isolate and i-test. And I think with regards to the laboratories or like yung testing facilities po, hindi pa po siya enough. Hindi po siya na-prioritize enough. Yun po.
Mika? Ito ba? Maria Patricia.
Yes, Doc.
Anything to add? Opinion? Was it utilized properly? Could have done better?
Doc, it could have done better po kasi ano po, yun nga po, hindi po nila alam paano kung gagawin sa mga, mas lalo po, Doc, sa mga financially illiterate po, Doc. Kasi, wala naman po problema if bigyan po sila ng amelioration fund, pero it would be useless if they are given money that only be utilized for just a day lang po. And they would just continue to just get money until, you know, marami rin po kasing kailangan paggamitan pa ng monies. And probably kailangan nga na mas maigi pong more important program po na po pwede mas sustainable for the marginalized po.
Okay. Ang sakit sa puso. Nakita, no? May isa, anong ginawa? Nagpariban. O, diba? Kamusta naman? Well, anyway. Money given, so how they chose, how they will choose to spend it. Technically, we have no say about that anymore. Okay. All right.
Doc, ano po, probably, Doc, kapag, for example, Doc, yung bibigyan sila ng money for, yun nga sa yung amelioration fund po, pwede pong uh, may proof po for not that they spend the fund for necessities like receipts po. For example, yung fund na po na binigay ay ginamit for their basic needs like medication if ever po. Then bibigay sa kanila yung receipt as return po.
I think it was done somewhat in, I think it is also in Pasig, but not in a big scale. So what they did was it worked like a cooperative. You have a basic need store, okay? And you have it. I think I don't remember if it's Pasig or Manila, but you have your credits. So your social amelioration fund went there, and then exchange it for goods. So at least the government will be sure that the services that you get, the money would be spent for what? For their basic needs and essentials. So you could not spend it elsewhere. So that system could have been placed, although that is like this is sino yun? Could you mute? Ayun. Sorry, the dog is my fault. Sorry. Where were we? Ayun, nawala na yung parang, ano yun, naliligo habang, habang nag-ESGD, na joke lang. Alright, so, a lot of problems to tell us. Now, what's the problem? Hospitals are full. What could we do about it? Again, lockdown. So would putting the Philippines in or at least the NCR in forever lockdown the solution? How would the economy survive?
The economy will survive by modifying. Like we cannot have the all jobs, so we have to give like different kinds of jobs. Like supermarkets, they have to deliver. They can give jobs to the delivery persons if they are not opening.
Again. Sorry.
I mean, like most of the jobs, we can modify the kind of jobs the people do. Like, for example, computer engineer. Usually they go to office and do their job, but now they can work from home.
Trying to
like
work.
I'm trying to say that most of these jobs could be modified so that the people could still earn, but also from their home.
Basically, doctor, we need to modify.
Yeah.
We need to modify our lifestyle.
How will
we need to be more aware.
How will we modify our lifestyle?
Like it will be different for every person. Like it depends on what job you do before this lockdown.
Give examples.
Okay. Yeah, I gave one example. And like you own a shop, like you own a grocery store. Before you just open the store and everyone comes and buys stuff. But now you cannot open a store. But still you have the stuff inside, so you can deliver it at their homes.
Okay. So and more online shopping has been abandoned. Okay.
Yes, ma'am. Like yeah. Even for general.
Even doctor, for many things like we should be aware ourselves as a citizen. We should always carry a sanitizer and we should put mask for our sake, not because the government has applied this rule. I have seen many people here even in India, they're only putting the mask because of the fine. Otherwise, we should keep use masks even indoors, and it should be our own awareness regarding this thing.
So you see, so same way. So as when you would become doctors and become public health officials or even administrators in your hospital, time and again you would have to prioritize different things. So I hope you go back and look at things. What's the report of the other clerks? Can we have you
It's program
have
planning.
program planning? Okay,
Yes,
let's
Madam.
have program planning next. Let's see how community organizing and prioritization would fit in program planning, and then the interns will show us an example of a program. Okay, go ahead, share your screen.
Um, Ma'am, can you hear me?
Yes, go ahead.
Uh, so this is block 7, presenting program planning for community health. So what is program planning? Program planning is a multi-step process that generally begins with the definition of the problem and development of an evaluation plan. Specific steps include a feedback loop with findings from program evaluation being used for program improvement. It identifies key areas of needs and interests based on data, including programs, policies, environmental support, and intervention to create a healthy culture, to support assessment results, health benefit design, and support outcomes evaluation, and align resources and infrastructure. So basically, it says that program planning is a method by which we identify problems in a healthcare system and find a way to solve it in a manner which is more accessible, cost effective, and time bound for a target audience. Next is the importance of program planning. So, program planning helps in understanding the statement of purpose by both by the extension workers and the people to ensure careful consideration of what is to be done and why. It is to establish objectives towards which progress can be measured and evaluated, to avoid waste of time and money and promote efficiency, to justify expenditure and to ensure flow of funds, to have available in written form a statement for public use. So basically, it will enable individuals or institutions to maintain a more holistic approach. It will empower people to create a system which is more goal specific. Also, for the stages of program planning, there are primarily 5 stages. The first one being to create a program goal. Stage 2 is to develop long-term objectives. Stage 3 is to develop and intervention. Stage 4 is to uh, create medium and short-term objectives. Stage 5 is to implement the program. And stage 6 is to evaluate the program. So for stage 1, it is to create a program goal. A program goal is a generalized statement of the result or achievement to which the program is directed. There are 2 main steps to writing a good program goal. The first one is to specify an expected program effect in reducing the health problem. And the second is to identify the subgroup or a segment of the population to be affected. So for the criteria for a good program goal is that A, it is a declarative statement. B, it is concise, meaning to the point. C, it is easily understood by professionals as well as masses. And D, it has positive terms. So, for example, is that we create a program goal for country X, which is to reduce exposure to secondhand tobacco smoke in children. Stage two of program creation is program planning is the development of long-term objectives. So long-term objectives are incremental steps needed to accomplish the program goal. They can also be called program objectives. These objectives should explain the result you expect your program to have in the long term. So for example, the goal is to reduce exposure to secondhand tobacco smoke in children in a X country. So our long-term objective would be a little more specific, that by the end of 2020, we would like to reduce 25% of the prevalence. Well-written objectives should include a subgroup, an expected result, degree of change, and time frame. Next would be presented by my colleague, Rosary.
Stage 3 is developing intervention. So now, since we have a program goal, we also have steps we need to get towards the goal, that is the long-term objectives, and we also have recognized and identified what are the obstacles that might get in the way of our program, that is the contributing factor to the program. We will now develop an intervention. So when we are developing an intervention, there are four main tasks or four main steps. First is the determining a health strategy. Now, health strategy can be of three types. One is, the first would be behavioral or educational, second would be environmental, and third would be the policy. So, a health strategy is a general plan of action for affecting the health problems. So, the example stated previously, for example, if our program is to prohibit or reduce the exposure of second hand smoke to adults or to people, one of the policy or one of the health strategy we can engage or we can adopt is the policy strategy, where the government takes or makes certain laws and rules which would help us in carrying out the program. For example, the government levying increased tobacco excise charges, taxes, or prohibiting smoking from all public places or in government buildings. So that would be determining health strategy. The second is researching existing evidence-based intervention. So since we have a problem goal, now we'll research on whether there are existing interventions in the past that had led to the desired result that we want. So we'll research on that, and researching on existing evidence-based intervention gains support for not only our program, but it is also cost effective, and it also saves time and resource during the planning and implementation. Third, previous slide. uh, yeah, previous. Yeah. Third, comparing interventions. In here, we compare the previous existing interventions and check how those interventions are matching our program. And there are certain criteria in which we compare the interventions, such as target audience, goals and objective, culture, cost. And comparing interventions is very subjective, but it is very, very important because it helps us narrow down our interventions. From 100, we can narrow down it to one or two. And the last would be selecting an intervention to adapt or create. We in this we can either select a pre-existing intervention and adapt it to our program, or we can create a new intervention so that we can achieve the program that we have created. So next slide. Stage 4, that is creating medium and short term goals. So medium and short term goals or objectives should be created because these are the benchmark of our program, and this clearly describes what we expect our program to accomplish. So medium term objectives are generally they describe behavior or policy changes, and the time frame for a medium term objective is 3 to 5 years, whereas short term goals or short term objectives seek changes in knowledge, skill, attitude, or awareness. And the time frame for short term objectives is 1 to 3 years. Giving an example, if we our program is to reduce second hand smoke exposure, our medium term objective can be reducing reducing the incidence of smoking, or reducing smoking in all households by 15%. And short term objective, an example for that could be awareness in our community about the harmful effects of secondhand smoke exposure by a certain year. So that would be an example. Next. Stage 5 is implementing the program. So implementing and developing a program, there are three major tasks. First is identifying the potential barriers to implementing. What are the obstacles we'll face when we are implementing the program? Second is, what is the work plan, or what is the plan which would help us achieving our objectives? So within that would come identifying the program components, creating a plan to implement, and then once the resources are secured, the implementation begins. So implementation can include marketing to a target audience, training, managing personnel, etc., etc. And the third task to developing an implementation of a plan is a communication plan. In a communication plan, the major objective is to keep the people who have made the program, the project members, and all the stakeholders informed of certain things. Certain things would entail what the progress of the plan, the obstacles, and whatever we want to inform the stakeholders and the project members. So that would come under the communication plan. Next slide. Okay, so stage 6 is evaluating the program. So evaluating a program is very, very important because evaluation measures the actual, that is what is really happening, and it compares to the intended, that is what we want to happen. So that is why evaluation is important, because it measures the difference between what is actually happening to what we had intended before, or what was our objective. So when we are planning for evaluation, it is important to have a concrete evaluation plan in place, because this would help us determining first in the evaluation plan. The evaluation plan is put into place in order to determine two things. First, what we are evaluating. Are we evaluating the progress of the program, or are we evaluating if the objectives, either medium, short term, or the long term objectives, are being met or not? And second would be, how will we collect the data? So that would go into evaluating the program. Next slide. So this would be our resources, and thank you.
So in any program, you have to, one, plan it properly. Second is you do the implementation, then you monitor the program, and then you eventually evaluate. Okay. So what are the important steps of planning?
So, ma'am, first we need to create a goal that what we would want to achieve, and we need to make sure that we take into consideration all the factors, infrastructure, monetary resources, the psyche of a certain subject group, any advantages or disadvantages. And once we have taken that into consideration, we can then develop a long-term goal and other short-term and medium-term goals in order to achieve the set target.
If we're going to apply it in community organizing, the principles of community organizing and problem prioritization, how will it fit in planning any program as far as health programs are concerned?
So, ma'am, if we take the current situation in mind, for example, with the COVID vaccination drive, so the governments across the world have set certain targets in mind, say for the year 2021. But in order to achieve those vaccination targets, they need to make sure that there is awareness and accessibility within small communities, within a certain area, across all age groups and across all economic and social sections.
Okay, fair enough. Okay. Let's see what the interns would have as an example before we discuss planning by itself. And be ready for the clerks to critique on the program planning that will be presented. Okay?
Okay, good afternoon, doctors. We are going to discuss about the response of the government to COVID-19. Next slide, please. But before that, let me have the objectives of today's discussion. At the end of the discussion, we should be able to define the role of interagency task force for the management of emerging infectious diseases and determine the different programs and policy of the government in response to COVID-19 pandemic, discuss the national action plan of the government, and lastly, discuss the implementations of each local government unit in response to COVID-19. COVID-19 as a pandemic. It's been almost a year, if not more than a year, that we are in a pandemic situation due to the spread of COVID-19 infections, or also known as novel coronavirus 2019. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization, but in some cases can develop into severe and critical form and may lead to death. In the Philippines, next slide please. According to the WHO data from January 3, 2020 to April 12, 2021, which is yesterday, of 2:37 p.m., we have 864,868 confirmed cases of COVID-19 with 14,945 deaths reported. And also from the WHO data as of April 1, 2021, a total of 770,751 vaccine doses have been administered specifically to the frontliners and the vulnerable populations. Next slide, please. So let me discuss first what is Interagency Task Force for the Management of Emerging Infectious Diseases. It is a task force organized by the executive of the Philippine government to respond to affairs concerning emerging infectious diseases in the Philippines. It was created through Executive Order number 168 in 2014, which was issued by then President Benigno Aquino III. It was organized as government instrument to assess, monitor, contain, control, and prevent the spread of any potential epidemic in the Philippines, whereby what we have in 2019, which is the coronavirus 2019. Next slide, please. So let me give you a brief background, a brief background of the organizational chart of the IATF EID. It was headed by the DOH Secretary, which is Secretary Francisco Duque, and it was co-chaired by the Office of the Cabinet Secretary and the DNR. All the members are all existing department of the executive branch. On March 25, 2020, the IATF EID revealed a national action plan to slow down the spreading of COVID-19. As of today, the pandemic has not only overburdened our healthcare system, but also exposed the inequities in our society. Next slide, please. So let me discuss the overview of the National Action Plan against COVID-19. It provides the national strategy which prescribes guidelines on how to contain and prevent the spread and ultimately eliminate the threat of coronavirus disease or COVID-19. Its ultimate goal is to safeguard the Filipino people and mitigate social, economic, and security impact brought about by the pandemic. Next slide, please. So the National Action Plan of the government is divided into 3 phases, which will be furtherly discussed as we go along with the discussions with my co-intern. Let me have the phase 1. It was implemented on March to June 2020, which primarily focused on preventing, containing, and eliminating COVID-19 while mitigating social, economic, and security impact. They have implemented lockdown during that time. And then on the phase 2, July to September 2020, brought further refinement of the strategies adopted to improve the health situation by keeping the number of related COVID-19 fatalities low, while also enacting measures to foster the economic recovery of the country. In this time of the pandemic, the government started to open the economy. Next slide, please. During the phase 3 of October to December 2020, it focuses on sustaining the economic and health security gains since the start of the National Action Plan's implementation. Next slide, please. The National Action Plan also shows how coordinated response are forged among the established government mechanisms against COVID-19 stemming from the policy guideline issued by the IATF EID and as executed by the National Task Force Against COVID-19 and its regional local task force. By the way, the National Task Force Against COVID-19 was headed by Secretary Delphine Lorenzana, the Secretary of National Defense. Now we are going to discuss the phases of the National Action Plan of the government one by one. Thank you. That's all, Doctor.
So for the phase 1 of National Action Plan, which ran from March to June 2020, it focused on the following strategic objectives. Number 1 is to provide a clear, accurate, and timely information to support operations against COVID-19. Number 2 is to contain and mitigate or lessen the spread of COVID-19. Third is to strengthen or sustain the conduct of operations against COVID-19. And number 4 is to mitigate the consequences and impact of COVID-19. As for the implementation, they have come up with a strategic design that considers the trajectory and risk level of the spread of the virus, the readiness of the country's public health system, the impact to social, economic, and security, and the capacity of our government to deliver essential services during public health emergency. So in this diagram, they made The overall goal is of the National Action Plan is to contain and prevent the spread and to eliminate the threat of the COVID-19 in order to protect the people and mitigate the social, economic, security impacts of COVID-19 during this crisis. So they have identified the current condition, um, appropriate lines of effort, corresponding objectives, and the end state. For the first current condition they have identified, the number of COVID-19 cases continue to increase and spread globally, um, to include the Philippines. In line with this, they have our country locked down, or they have this enhanced community quarantine. Their objective for this is to provide clear, accurate, and timely information to support operations against COVID-19. In the end state of this is that the spread of COVID-19 is to be prevented and contained or eliminated. Second is that they identified that ECQ adversely impacted the economy. So with this, they provide an enhanced monitoring and response. So the objective of this is containment and mitigation of the spread of COVID-19. And then for the end state, the social, economic, and security impacts are to be mitigated. Third is that third, they have identified that the government services are hampered. In line with this, they have responsive sustainment. We will elaborate this later. Sustainment of the conduct of operations against COVID-19 is the objective, and for the end state, the government and the private institution resume normal functions. And then last is the livelihood of people are being affected. So the lines of effort for this is to provide a crisis communication. So the objective for this is that the mitigation of the consequences and impacts of COVID-19, and that the people should adapt to the new normal. So this is an operational concept of the end-to-end T3 management system, which is the test, trace, and treat. And this concept is subdivided into 6 lines of efforts. That is to prevent, detect, isolate, treat, reintegrate, and to adapt to the new normal. So for the prevention, they provided a national communication campaign that is to wash your hands, keep your distance to stay safe. And then for the detection, they provided testing like swab tests, RT-PCR tests, and rapid antibody tests. And for the tracing, they have contact tracing teams plus digital applications. For isolation, they have quarantine or isolation facilities, provided home self-isolation, community protocols. And for the treatment, they have home isolation, quarantine facilities, public and private hospitals, central PPE procurement. For integrate, awareness for possible reinfection and social distancing and safety um, protocols. So they have identified that the country's best defense is through establishment and observance of the minimum health standards and um, person, personal and community hygiene, social distancing, and personal protective cares. So here is the summary of their strategic actions, um, divided into 3: preparedness planning, preventive and protective response, and readiness for response. For the preparedness planning, they have rapid establishment of national coordination response to deliver strategic, technical, and operational support through existing mechanism and partnership. Second is to scale up the country's preparedness and response operation through the following. So we have strengthening readiness to rapidly identify, diagnose, and treat cases, identification, containment, and monitoring of contacts with priority given to high-risk settings such as the healthcare facilities, infection prevention and controls among healthcare settings, implementation of health measures for those who are traveling, and awareness raising in the population through risk communication and community engagement. For preventive and protective response, they have community quarantine to immobilize potential carriers, limit contagion to localized scale, and allow contact tracing and tracking. Number 4 is to enhance monitoring and response intervention. This is to have a speedy identification of a suspect, probable and confirmed cases, and application of the right protocols on the environment where the suspected and confirmed carriers are located, relocation of the COVID-19 carriers to the designated isolation of quarantine facilities, and of course, the treatment of the carriers until they are reintegration to their communities. Number five is responsive sustainment. This is to allow us to sustain the provision of supplies and logistic requirements to the frontliners. For the readiness for response, they have this again, crisis communication. This crisis communication helps us to hasten the exchange of information from those decision makers and those target audience by reducing the bureaucratic processes using all available platforms of communications possible. Last is accelerating priority research and innovation. This is to support clear and transparent global process to set research and innovation priorities. And this is to scale up the research and development. So they build they build a common platform for standardized health processes and protocols and tools to facilitate this research based response.
So for phase 2 of the National Action Plan, next slide. So the National Action Plan phase 2 covered the period of July until September 2020. Phase 2 anchored on the PDITRM, meaning P for prevent, detect, isolate, treat, reintegrate, and people adapting to new normal, which is the mainstream, with prevention and containment as its main components. Next slide. So phase 2, the focus po ng phase 2 is establishment and observance of the minimum public health standards of personal and community hygiene, social distancing, and the wearing of personal protective gear like face masks and face shields. So testing and tracing serve as the primary task in isolating and containing the spread of the disease. So phase 2 of the National Action Plan implementation shall primarily focus on economic recovery while still improving and sustaining the gains we made in public health capacities. So ito po yung summary ng 3 phases. So phase 1 ran from March to June 2020. Primary focus, ito yung prevent, contain, eliminate the threat. For economy naman, limited mitigation. For phase 2, cover the period of July to September 2020. For health, further improve or sustain, keep fatality rate low. For economy naman, primary economic recovery. And for the phase 3, which ran from October to December 2020, health and economy sustain. So yung key features of phase 2, one, promoting change in people's mindset with a strong focus on health and disease prevention. Second is striking a strategic balance between the health and economic objectives. Mainstreaming the prevent, detect, isolate, treat, reintegrate strategy and zoning containment strategy at the regional, provincial, and city levels. Sustain private and public partnership, emphasizing strict observance to health standards and protocols through risk communication and community engagement. Putting a premium on business continuity and sustainable plans for both the private and public sectors. Managing the returning overseas Filipinos, locally stranded individuals and local travelers, and ensuring their safe return to their home provinces. And lastly, conducting expanded testing and aggressive contact tracing in order to gradually allow travel, tourism, and non-disruption of work. Next slide po. So yung framework of the National Action Plan Phase 2, composed of objectives, lines of effort, health and economy, and end state. So yung position ng objectives, yung contain, and manage new COVID-19 cases in high-risk areas. Also to sustain wins against COVID-19 and continue best practices, balance the nation's health and economic welfare, localize COVID-19 response by guiding people support and participation, and keep low fatality rate including non-COVID-19 cases. For lines of effort naman, response, operations, recovery, food security, resource management, and logistics, management of returning overseas Filipinos. For health and economy naman, people-centered, nationally support, locally led, then people adapting to new normal, new end state, which is the COVID-19 virus is contained and managed, public is well informed and uh, learn to minimum health standards, communities are adaptive and resilient. Economy has recovered and is stable, equitable access for the vaccine for poor communities. So next slide po. So summary po ng phase 2, S for sustain the gains. Phase 2 shall sustain gains by continuously building the capacity of the country's health system, capacitating the local government units down to the lowest level to effectively and efficiently handle COVID-19 efforts through the timely provision of supplies. Third, A, address the resurgence. So phase 2 should be able to address the resurgence with the infusion of a clear, accurate, and timely data on COVID-19, effective management of returning overseas Filipino, and local travels as the virus transmitted with movement of unchecked people, and the institutionalization of the prevent, detect, isolate, treat, reintegrate, or the PDITR strategy down to the lowest level with emphasis on prevention and contact tracing. And last, for R, recover the economy by slowly reopening our public transportation systems as well as implementing even more flexible restrictions on economic activities so that businesses across the country can again profitably operate with while maintaining safe health standards. So yun lang po.
Hello. So for the phase 3 of the National Action Plan, it's done on to December 2020. So the main focus is to sustain the gains from the previous phases while providing an equilibrium both on health safety and economic recovery. This transition plan to the new normal from the last quarter of 2020 to the first quarter of 2021. It has kick-started the development and early implementation of the Philippine National COVID-19 Vaccine Roadmap. So its main components are prevention and containment of the virus. Yes. So the key areas, the need to further strengthen the PDITR strategy, focusing mainly on the prevention and detection, active case finding in the communities to proactively detect possible cases even without the testing is necessary to ramp up the detection capacity. The imperative to secure sufficient quarantine and isolation facilities where the COVID cases can stay until they fully recover. So there is the implementation of no home quarantine policy. An example is in the schools, Navotas, and other parts of NCR. And such policy has greatly reduced the active cases in these areas. The maintenance of continued collaboration with the private sector. So the code strategy, so these key components, the community engagement activities to promote the preventive behaviors and active cases finding via house-to-house symptoms check, RT-PCR testing for symptomatic patients, and offline kalinga application for those needing quarantine and isolation. Offline Kalinga is an initiative, is a program launched by the national government to accommodate COVID-19 patients who do not have their own room or own toilet where they can isolate themselves, or for those who have household members who are elderly with existing disease and pregnant women. This is to reduce the risk of more infections in the household communities and to identify and isolate infective individuals in proper isolation and quarantine facilities. So next po. So the key features of phase 3 is focus on response and early recovery with a gradual reopening of the economy. Enhance the PDITR strategy to be responsive to the emerging realities and continuous delivery of social programs while observing the minimum health standards. Inclusion of vulnerable groups in digital transformation to lessen the digital divide, and formulation and early implementation of national COVID vaccine roadmap. It strengthens the data and information management and improves structures that will facilitate the implementation of the National Action Program Phase 3. Next. Also, it intensified the risk communication down to the barangay level and intensified capacity and capability building of the NGAs and the LGUs. Localization of national efforts such as the code and the One Hospital Command Center, Oplan Kalinga, and Operation Listo for the management of emerging and infectious disease. So the One Hospital Command Center is the that facilitates a comprehensive and coordinated response to the COVID-19 pandemic by ensuring effective and efficient health facility referral in Metro Manila. Uh, this also facilitates the medical transport and patient pickup arrangement, provide health, serve, health system capacity, data analytics, and risk communication, and the optimized use of critical care service of every hospital in the area. And Operation Listo, however, um, uh, is a step-by-step and scenario-based tool that is applicable to both cities and municipalities. It is based on the PDITR program that is it is based in the PDITR that was mentioned earlier. So with this with these programs, the people-centered and LGU-led and nationally enabled approach and strengthen the multiple stakeholder partnership both in public and private sectors. Um, it is also strengthen the monitoring and evaluation system in response to the COVID-19. So here is the National Action Plan Phase 3 response. Of course, focuses on preventive detection, isolation, treatment, and reintegration. So here, in prevention, it is added here at the bottom the observance of health protocols in public spaces, workplace, and at home. And also, they implemented granular lockdown. Here in isolation, they included that there is no home quarantine policy and expanded the Plan Kalinga. Here in the treatment, the um, they also increased the capacities of the ICU. Next, please. So here, there is the 4 zoning classification. This zoning containment strategy is applied in order to identify the focus area for implementation of varying levels of quarantine. This is depending on the risk and stage of transmission prevalent in the area. Therefore, zoning classification that is being followed, namely the critical zone, containment zone, buffer zone, and the area outside the buffer zone. It aims to contain and prevent the spread of COVID-19 and mitigate its impact on local economies through contact tracing, testing, isolation, and treatment of suspect, probable, and confirmed cases to be implemented by the local task force. Next slide. So here in this slide is the NAP COVID-19 Phase 3 operational framework, focusing on the recovery, vaccination, and response. So for the recovery, so here is to support the reduce of morbidity and mortality due to the COVID-19 and non-COVID-19 diseases. and also restarts the social and economic activities and for good governance. And now we can focus on the vaccination. Um, uh, the this implements the national COVID vaccination roadmap and implementation plan. It shall be guided by the assess, plan, prepare, execute operational phases with the corresponding strategies. For the assess and plan phases, organization of mechanisms such as the BP and NITAG and HTAG to facilitate the scientific evaluation and selection of the vaccines, having a portfolio of vaccines on different platforms from different countries. Issuance of emergency use authorization by the FDA, an organization of interagency vaccine cluster with task groups and sub-task groups. Mobilization of private sector support for logistical and support services requirements, and establishment of information system for profiling, screening, and registration of eligible population for vaccination, vaccinators, and supply chain facilities. And also, the establishment of monitoring and evaluation system. So if you can see now that these assess and plan phases have already been started during March when there is the start of giving the vaccination rules first to the healthcare workers. There is this uh plan and the ano tawag to? um focus on which priority groups will be given first. And then the prepare phase involves the following strategies. Entering into the advanced market commitments with the private vaccine developers and the release of advanced payments to them with the Asian Development Bank as a fund manager and procurement agent. So there is also the diplomatic engagement for government to government and multilateral engagement and having various modes of financing through the procurement of RA 9184, COVAX facility, multilateral loans, bilateral loans, private sector financing through a tripartite agreement, and capacity and capability building for facilities and vaccinators on vaccine storage and deployment. So in the execute phase, the execution of information, education, and communication campaign, plan, and social preparation down to the barangay level for vaccinations. As you can see, that this information not only have was down to the barangay level, but also can be seen on social media by the DOH. So the adaptation of geographical and sectorial prioritization criteria for vaccine deployment. So this is just one of the problems of our of deployment of the vaccination, because there are since the Philippines is a archipelago, and the problem is how to distribute the other vaccines through the the considering the geographical assessment of the of our country. So the utilization of supplemental immunization activity mechanism for COVID-19 immunization and adaptation of effective waste management system for collection, transport, treatment, and disposal after the vaccine administration. So for the recovery efforts, this was discussed earlier, and still through the prevention, detection, and isolation, treatment, and reintegration program. So these main three strategies shall be supported by the intensive IEC campaign, capacity development for NGAs and LGUs, localization of national efforts, and strengthen the public-private partnership in application of the zoning containment strategies in areas with the surge in cases. So for the overall goal of this phase 3, this is to reduce the number of cases and the rate of transmission, improve the healthcare system capacity, implement the national COVID-19 immunization roadmap, provide safe and sufficient transportation to the public, and reduce the underemployment and employment rates, and ensure the business and services continuity. It also will mitigate the socioeconomic contraction. So that ends for the NAP COVID-19.
Hello, good afternoon. So now we'll be talking about the role of the local government unit following the national action plan set by the national government. So um, obviously, the local government unit plays an important role in handling the COVID-19 pandemic, specifically catering to the population that they serve. And in the past year, there are a few notable local government units that took on a creative or a more flexible route in adapting to the needs of their people within the various policies and restrictions that came along with the prolonged community quarantine. So, the following slides will be talking about a collection of good practices of the local government units as collated by the Department of Interior and Local Government. So, first is the online palengke to decongest the marketplace seen in Plaridel, Bulacan. So this aims to reduce the need to go outside by allowing residents to order online through a Facebook group created by the local government unit. So this both serves the consumer and the market vendors, one by decongesting the marketplace, hence reducing the spread of COVID-19, and two, by allowing the market vendors to sell their goods. So as you can see in the photo, it's a public group that everyone can view. So a lot of people have been joining and selling their products here. So next slide, please. Next is the Bataan household text registration seen in the province of Bataan. So due to the extension of the ECQ, the provincial government of Bataan continuously provide aid and assistance to different households, including the vulnerable sectors. Hence, they launched the Bataan household text registration to aid the LGUs to identify the target beneficiaries and provide real-time information to its constituents. So this aims to assess necessary information of the population, specifically the number of people per household and their corresponding addresses. So this facilitates accurate allocation of relief goods, faster distribution of goods, and provides real-time announcement on schedule of distribution of goods. So this promotes transparency and accountability as it informs the local government whether the individuals have received their goods. So as you can see in the photo, the residents of Bataan can register via text message by sending their information to the appropriate number. Next slide, please. Next is the virtual COVID-19 emergency help desk seen in Pampanga and in Tarlac. So in Clark, Freeport, and Special Economic Zone officials launched a COVID-19 hotline together with Task Us to help address the different issues of the citizens. So it's a hotline that operates from 8 a.m. to 1 a.m. daily, wherein callers will be received by hotline operators who are capable of answering basic inquiries on COVID-19. If it's something that they can't answer on their own, callers can be easily directed to nurses and medical staff of Clark Development Corporation Health and Sanitation Division. Next slide, please. So another is Adopt a Family Project in Candaba, Pampanga. So this initiative encourages the well-off families in Candaba to adopt indigent families and sustain their food and other necessities for the whole duration of the ECQ. Resulting in the adoption of a total of 52 indigent families. On April 2nd, 2020, Mayor Rene Maglanuque led the first payout of the financial assistance to the beneficiaries of the Adopt a Family program. So in the photo, we can see the mayor handing the financial assistance to Mrs. Rosalie Palo of Barangay Bahay Pare Candaba, one of the first beneficiaries of the Adopt a Family project. Next slide.
So next we have Tarlac officials donate salary in fight versus COVID-19. So Tarlac Governor Susan Yap donated her almost 3 months salary to buy 500 units of rapid diagnostic test kits to be used in the province's fight against COVID-19. So the rapid test kits amounting 375,000 pesos will be used by the Tarlac Provincial Hospital and other government hospitals in the province in testing probable COVID-19 cases. So likewise, the entire salary of Vice Governor Carlito David and all the 13 board members that comprises the Sangguniang Panlalawigan of Tarlac donated their salaries for the month of April to help in the provincial government's fight against COVID-19. Their entire salaries for the month of April amounting to 1.2 million pesos as their collective effort to extend help and assistance to their constituents in the province to mitigate the impact of COVID-19. Next. So, since the COVID-19 outbreak, ascorbic acid or vitamin C and other multivitamins have been scarce, if not unavailable in local drugstores here in municipality of the Dingalan Aurora. So, malunggay leaves is one of the indigenous so its richness in vitamins and minerals is very cheap way of strengthening one's immune system. So the Sangguniang Kabataan of Dingalan Aurora has initially launched malunggay tea stations in their respective barangays and have promoted its health benefits to its constituents, not only for the youth but for all ages. So the SK Municipal Federation President, CJ Borreo, here in the picture below, personally prepared the malunggay tea and set up a drinking station that was made available in the barangay for frontliners and those in the barangay hall. Next. So, next is the P2P service in Barangay Dila, Laguna. So, the Sangguniang Kabataan, youth volunteers of Barangay Dila, Laguna initiated a free ride project named Barangay P2P Service. So operation of public transport is prohibited during the community quarantine to mitigate the spread of the virus. This caused struggle to frontliners as well as those who need access to the market to buy food, medicine, and other necessities. To remedy the inconvenience, Barangay P2P service is provided to residents going to and from the public market. So the service traverses 3 routes. The schedule of ride is every Mondays, Wednesdays, and Fridays from 6 a.m. to 12 noon. So before embarking, passengers are required to use sanitizers provided by the SK officials. Social distancing is observed, and therefore the 15-seater Nissan Urban only accommodates 9 passengers. So next po. Yeah. So even before the COVID-19 crisis, there has been a high demand on face masks since the first month of the year 2020 due to volcanic eruption of Taal. So there is scarcity of supply of masks in stores because the demand continuously increases as people buy out of panic caused by the pandemic. So the city of Binyan in the province of Laguna seized this opportunity to provide livelihood to their people as well as to supply for the frontliners. So they were able to produce and distribute 5,000 reusable face masks in March. Afterwards, the city discovered face mask making as an income opportunity for the community during enhanced community quarantine. So through social media, Mayor Walfredo Di Maguila Jr. called for volunteers, sewers for the mass production of face masks and personal protective equipments.
Good afternoon, Doctor. So another example of an LGU COVID response is seen here in the picture. Next, please. So one of the examples is the Carmona. Carmona sets up DIY sanitation tents. So the local government of Carmona produced a do-it-yourself improvised sanitation tents that could help in the sanitation of health workers, patients, LGU employees, before entering and leaving facilities such as hospitals or municipal hall. And the design was provided by the UP Diliman-based volunteer group Sanitens PH. And soon after Carmona started setting up their tents, many cities also started putting up their own tents. And disinfection sessions were also conducted at all checkpoints across Carmona as part of the preventive measures and mitigation efforts being implemented by the local government to keep the community coronavirus free. Also, they continue to distribute disinfection machines to barangays in line with the preventive measures and again mitigation efforts of the LG of Carmona. And also there were orders that's being taken and received by the residents of Carmona, starting through the Bayan May Libreng Delivery, which is an initiative of the municipal government of Carmona to provide free delivery service from the public market to the residents as a solution to the suspension of public transportation and implementation of social distancing. Next, please. Next is the backyard farming and support to local farmers in Odyongan, Romblon. So in times of crisis such as this COVID, Filipino proves that we are resourceful in our own unique ways and we remarkably strive no matter what crisis we are in. So during this time, most of the Filipinos um, probably depend on the food provided by the government since most of their jobs and source of income has been affected due to COVID, except of course the health those who work in healthcare sectors or the food industry, and that so the local government of Odyongan promotes family food sufficiency by promoting backyard farming. This backyard farming is implemented through its municipal agriculture office through the distribution of different varieties of seeds to their constituents, including seeds of easy-to-grow vegetables such as string beans, okra, eggplant, and petchay. Also, backyard farming does not only help the residents of Odyongan to have their own source of income, but this also minimized the spread of virus since they don't need to risk going to the market. And it is also the LGU of Odyongan saw this opportunity to support their local farmers and their fisher folks. And so they procured agricultural products from their local farmers and fresh fish local fishers for the relief packages as part of the relief being provided to their people. Next po. Next is the ay hindi na po wala sa akin. Next is the mobile Tiangge, showcases local harvest in Boac, Marinduque. In this mobile Tiangge, they sell variety of products produced by the locals to different barangays in town such as fresh meat, chicken, and fish. And this effort helped the farmers and other merchants to earn even under quarantine. So even if their city or the whole nation is put under quarantine, these local farmers and other um, merchants didn't still had income, and that this project also gave convenience to the residents since public transportation has been suspended, and that going downtown requires time and effort, especially residents living in distant barangays. And additionally, this also helped the community to strictly practice social distancing to stop the spread of the virus since the Tiangge roams around different barangays. Next po. So this is one of their mobile Tiangge in Marinduque. Next is the rice relief to help local farmers and cash assistance of Bayugan, Agusan del Sur. So the Bayugan City LGU started the citywide aid to support its almost 30,000 households in 43 barangays by providing not just a kilo or a few kilos of rice, but a full sack of rice for every household and cash assistance for their constituents settling in the urban areas of the city. A full sack of rice were provided to every household living in the rural areas to intend to help the city farmers to earn amid the crisis, while the cash assistance aims to keep the flow of economic activity in the city quarantine. Bayugan City still remain a zero COVID-19 positive case. That is why a 24/7 emergency operation center is established in its city hall to monitor the strict implementation of the quarantine protocols. Next po. This is just one of their warehouse showcasing the sacks of rice being distributed to different barangays. Next po. And this is also a picture of the vegetable seeds that are easy to grow being distributed to different constituents of their barangay. Next po.
So another role of the LGU is to ensure that the information reaches the residents. And Barangay Maharlika District City Intervention did that by using mobile loudspeakers and distribution of leaflets. So this is not their first time using the mobile loudspeaker in leaflet distribution. They've used this also before during the Yolanda crisis and the Marab siege. So the information that they are disseminating through this are factual information, the importance of taking precautionary measures such as social distancing, staying at home, eating healthy foods, and proper hygiene and sanitation to avoid the spread of COVID-19. Next slide, please. So another example is the San Francisco Agusan del Sur from canned goods to healthy vegetables. So instead of distributing canned goods as ayuda or their help to the people, they are cooking healthy cooked vegetables. So it is to provide a healthy and nutritious food, and they also believe that vegetables instead of canned goods can help strengthen the immune system and help the constituents to avoid the virus. Next slide, please. Next is the community-based monitoring system done by City of Tacorog in Sultan Kudarat. Actually, the CBMS is institutionalized through the Republic Act 11315, also known as the CBMS Act. So CBMS is a poverty diagnostic tool used for evidence-based planning and policy and program implementation and monitoring. So with this, they can identify the people who are vulnerable and most affected by crisis. And with this, they can respond rapidly and they can manage their resources effectively. Next slide, please. So next is the Bagsak Presyo Market on Wheels by Dalabangan, Zamboanga del Sur, LGU. What the municipality of Labangan did is they were the middleman of the farmers to the buyers. So it is to provide the municipal residents to an alternative access to the market. So with this, they can also help not only the buyers but also the farmers that is in barangays that are currently in lockdown. So they can help the farmers sell their produce, and they can also help the buyers have access to the produce. That is all po. Thank you.
Okay, very comprehensive. What are your thoughts about the programs launched by the local governments and the national government? What are your thoughts?
For me po, from on the side of the national government, it's very generalized because it would um the population that they are catering to is the entire nation. However, for the LGU, they know their people, they know what their people need, so it's more catered to that, so they can address what the people currently need.
Okay, that's why we have our local devolution code where in power of the local government as far as health is concerned would be transferred to the local government because they are closer to the problem rather than the national government. how would this how could you say the planning is good? Well, in any plan, if it's on paper, okay. But how do you think is it implemented? What are the mechanisms for monitoring and how do they evaluate the program? Um, are you happy with how it's implemented, monitored, and evaluated?
Doc, in my opinion po, Doc, the way they evaluate po, Doc, is it's kind of technical po, Doc. And usually, what they were given on hand in with their data, yun lang po yung nare-reflect through their information disseminations po, Doc. But in reality po, Doc, it doesn't really reflect the reality, eh, what hap- what happens on the ground po, Doc. That's one problem po. For maganda the program or the planning are good po, Doc. But the problem is the execution and the evaluation. It doesn't reflect the realities on the ground po, Doc.
Okay, so how is there room for improvement? I'm sure there is. In what way do you think we could still improve? The plan is quite good. It is lacking in implementation, of course, monitoring and evaluation, so that we could go back to the boards and plan again. Okay. The clerks, any comments? How is it in India? COVID response. Is it any similar to what was discussed for the international clerks? Last question, we're quite over time. Anyone from the September or anyone from the international? How will you compare the COVID response in India with the Philippines? Anyone cares to answer? How is it?
What's the question, ma'am?
How do you compare the program discussed by the interns with the Indian program as far as COVID response is concerned? Yes. Anyone?
Sorry, ma'am, don't know. I don't watch news that often, so I don't know.
Anyone? How is the COVID response in India? You don't need to know the policy. How are the responses there brought about? Government.
Like
Ma'am, actually, different states are responding in different way. That's why I think people are, it's impossible to entire India, the response of entire India count to take in one page. Different states are taking different steps and measurements, and in few states, elections is going on. This is election time. Okay, so in India, election is a big thing. Like it's called the biggest democracy. So in this pandemic time also they are marching, they are going for political rallies, and government is quite casual about those things in some states. So COVID, in the meantime, the spike is going on, but people are not noticing it. But once they will notice, I think government will take measures. But yeah, at least 3 or 4 states, it's the election time. So like we said, the head of our state is chief minister. So that's election. So yet it's not entirely lockdown, but it's already, if you have seen the news, India has crossed the Brazil to take the second position as the worst hit country. So but it's going up worse than that the before, but it's not yet entirely locked down. But like offices are also open, schools are closed, online examination is going on, but medical colleges are open, the examination is going on, the licensure exam, like there is an exam called, like for medical students who wants to do post graduation, that exam will be in next Saturday, that will be also in offline, like in online center, it will be not online. So there is no lockdown yet in many states. Some of the states, I think, they are taking some strict measurements, but in my state there is no lockdown. Everybody is going on, and people are quite casual, but the numbers are increasing. That's the real scenario.
Okay. All right. So that is community organizing, problem prioritization, program planning, and an example for you this afternoon. Okay.
Hello, doc.
Yes.
One of the girl got disconnected. Darshana Raju. Can you please add her again?
What?
One girl got disconnected, doc.
I just admitted her.
Okay, thank you, doc.
Okay, could you open your video? We will have a class picture. Okay, could someone do how is this? Okay. All right. So that's it for the afternoon. We will post City Junelta later tonight. The assignment for Thursday, we will talk with Dr. San Luis. Okay? Thank you for attending this session. Good afternoon. All right, we may leave this call.